Hello, I'm Dr. Jim LaCour, and I'm here today to present to you a wild pig disease workshop as part of our 2020 International Wild Pig Conference. So we're here to talk about diseases. That's kind of what I do, so I want to share some stuff with you on that. Wild pigs, or the genus and species Zoonotic, that's the same thing as the pretty little pink pigs that you see in the farmer's market. Um, they are susceptible to a myriad of diseases and parasites. In fact, I had an old teacher that called them a sport utility vehicle for disease. They carry a lot of different things. Uh, the wild pigs can transmit these diseases to domestic pigs. If that happens, some of these diseases can result in great trade embargoes, which is a very real number that we try to prevent from happening. It can, if we get some trade embargoes for some diseases, it can get up into billions of dollars pretty rapidly. Additionally, some of the diseases of wild pigs are zoonotic. They're contagious to humans. Uh, Pigs have tissue types that are very, very similar to humans. And in fact, that's why some of these things, they use pig parts for heart valves and aortas and veins and different things. So we are pretty similar, and that maybe makes us a little more prone to getting some of their diseases. So we do surveillance for these diseases to see what's out there on the landscape. Number of different types of surveillance. The majority of them are serosurveillance. So we take blood from wild pigs that have been killed. We let that blood clot and spin it down. It separates to the red cells and the clear fluid, which is the serum. That serum has antibodies in it. So if this is the bacteria or the virus, the body makes antibodies to it. So we can count these antibodies in the serum and see if they're present. And that's how we can tell if some of these diseases are present. We can also, at times, depending on the disease, get an idea of recent infection, active infection, versus an older chronic type infection or exposure. There are many other laboratory tests that we do for surveillance and disease testing, depending on the disease. One of the newer things coming out is genomic testing, actually looking at the genes in the organisms that are circulating in the blood. So that's pretty new and pretty cutting edge, but that's opening up a lot more sensitivity to us and some specificity. And we'll talk about especially one disease later on that has probably come to the surface just because of advanced testing. So let's move on forward. What about COVID-19 in pigs? The reason we're doing this webinar instead of meeting in person is because of COVID-19, coronavirus. The current information that we have from some of the most recent research shows that pigs are fairly resistant to COVID-19 and that the virus replicates poorly in pigs. So there's going to be more research on that. There may be some different outcomes of that research, but for now, it looks like they're fairly resistant. So that's good news for us. We're going to move on to some of the things that I work with every day. Swine brucellosis. Swine brucellosis is a bacterial infection caused by Brucellosis. It's a facultative anaerobic bacteria. In pigs, it's transmitted venereally or by contacting infected fluids or body tissues. So if a pig contracts it venereally from another pig, they may circulate that bacteria in their blood for up to 60 days. It often will cause sows to abort that litter after the infection. If they get bred, may abort one litter, but after that, they typically don't abort. The aborted fetuses, the afterbirths, and subsequent birth fluids are just teeming with this bacteria. So pigs don't let much go to waste. If they have abortions, typically the piglets will get eaten. The afterbirths are eaten, and so through that mechanism, it can be spread also from pig to pig. This was a problem in domestic swine for many years. Currently, due to a very aggressive test and slaughter program, it's been eradicated in domestic pigs in all 50 states. We still in wild pigs pick up about a 5% positive rate in blood. So in a serological test, pick up about 5% of them as being positive. Hold on. So a recent study done by USDA in the slaughterhouses in Texas, in the feral hog or wild pig slaughterhouses, also showed about a 5% serological positive rate on the blood from those pigs, but they went in and cultured the lymph nodes and actually cultured the bacteria out of about 13% of the lymph nodes. So that indicates to us that we're probably underestimating the prevalence with our seroprevalence rate doing surveillance across the countryside. And this is a bacteria that once again is spread venereally, so you would expect normal spread of this disease to start as a pinpoint and very slowly move out from that center. So if you're testing in that center, you get a bunch, and if you're outside that center, you get a few. When people move pigs from one area to the other, they move the diseases with the pigs. So you may, that means you have positives here, and then all of a sudden they're over here, and from there over here, and so movement of animals also moves the things they're carrying. So in pigs, we already talked about abortions. Brucellosis can cause infertility, orchitis, which is swelling of the testicles, oophorytis, which is swelling and inflammation of the ovaries, lameness, joint abscesses. They get abscesses in their spine. It is zoonotic. It affects people. It's a very severe disease in people, especially if left untreated. So in people, brucellosis causes a disease known as undulant fever. And undulant fever is called that because it's very high and very low, and it comes and goes. Sometime every night you get fever. It may come up for a week and go down and come back. But if left untreated, this is a lifelong disease of humans and can make them very sick. A lot of people say it feels like you have the flu. Humans can get this disease by ingestion of undercooked pork, by cutting themselves and getting bacteremic or infected blood or reproductive fluids in a cut, or by simply getting those liquids onto the mucous membrane. So in your eyes and your mouth, you can contract those diseases. This is a picture of a boar with orchitis. He's got swelling, actually abscessation of one of his testicles. That's about the only sign you might see looking at wild pigs out on the landscape. So this is not a disease you can look at a pig and say, that one's got it, that one doesn't, that one's got it, that one doesn't. So this is about the only external sign you may see that you may recognize that animal may potentially have brucellosis. Leptospirosis. This is another bacterial infection. This is caused by a spirochete bacteria. This thing looks like a little barber pole and twists through. When you're looking at it in the microscope, it twists around like a screw going through wood. So this bacteria typically colonizes kidneys and is shed in the urine, and as such, it can contaminate water and soil. This is a typical wild pig rooting. You can see the water sitting there. As those pigs root along, they'll urinate into that water, and that water makes it, it becomes infected potentially with that leptospirosis. Same with bayous, streams, sloughs, creeks, what have you. Many serovars. A serovar is a serological response to a different variety. So these basically, if you want to think of them as subspecies, you can. And there are a bunch of them out there. Some of the ones that we look at commonly are Bratislava and Pomona, which are very commonly found in pigs. So the pigs can become carriers of those, although they are susceptible and can get most any of these other serovars of the leptospirosis. Harjo is commonly found in cattle, Leptospira harjo, and it's also found in pigs that live in close proximity to cattle. Those of you who spend a lot of time in the field know that if you have a cattle ranch, the pigs are commonly mixed right there with the cattle, and they do share organisms back and forth, and leptospirosis is one of those. So animals that are affected with leptospirosis can get fever, lethargy, they feel bad, they get blood tinged or wine colored urine, they can get abortion and death. So it's long been considered a very common cause of abortion in cattle, especially in the southeast, because there's so much water. It's a waterborne bacteria, and cattle become exposed and abort. We've also seen white-tailed deer that have aborted from leptospirosis as well. So this is a bacterial disease that is commonly vaccinated for in domestic animals and domestic livestock. Of course, in the wildlife, we don't generally have that luxury to vaccinate them. So in Louisiana, in my state, some serological surveillance showed that up to 80% of the pigs had been exposed to leptospirosis, and the titer was such that about 12% of those probably had active infection when we were testing them. So once again, Bratislava and Pomona are commonly represented in pigs, but we've seen the whole gamut of these different serovars in the pigs as well. Leptospirosis is a zoonotic disease. It's actually on the increase. Most of the cases in humans come from exposure to contaminated water, so floodwaters, creeks, ponds. The clinical signs are fever, a rash with petechial hemorrhages. Petechial hemorrhages are little pinpoint hemorrhages, can be anywhere on the body. Jaundice or yellowing of the skin and eyes, mucous membranes. Hemolytic anemia, the blood cells start to break down. Renal failure, this is a kidney organism, and then possibly death even. This is a couple of pictures of human cases. The upper left hand corner, there's yellowing of the skin. There is yellowing of the eyes. There's some hemorrhage in the eyes. Lower right hand, there's petechial hemorrhages from this leptospirosis. And once again, this is becoming more common. Wild pig numbers are going up. People are getting back outdoors. There are a lot of people, and where that human wildlife interface comes to fruition, we sometimes get disease. In about 10 or so, 15 years now, I guess, just around Hurricane Wilma in Florida, there was an adventure race, and a lot of water out and about then, and 44 of 200 participants in that race were diagnosed with leptospirosis from getting scratches and going through that water that contained the leptospira bacteria. So it's out there. Just a cute little picture of a pig coming out of anesthesia chewing the tires on my truck. I thought y'all might like that. Toxoplasmosis. Now, most of the time when you hear about toxoplasmosis, you think of cats in litter boxes and pregnant ladies, and those are all true correlations. Cats do shed toxoplasma, um, protozoal organisms in their feces. It sporulates in the litter box. And when ladies clean the litter box when they're pregnant, it can cause problems. But Toxoplasma also infects muscle tissue and makes cysts in the muscle tissue, which can infect humans if they eat undercooked pork or other meats, but pork especially. Um, Toxoplasma gondii is the organism. It's a protozoa once again, protozoa. And wild pig prevalence rates are variable, but they typically run between 18 and 28% positive for this organism. So it's typically doesn't do much damage to the host animal. The animal has these little cysts in its muscles. They get around pretty well. Occasionally we'll see animals in my shop that come through that are neurological and they have toxoplasma in the brain or in the neural system somewhere that's causing a problem. And they were probably immunocompromised to get those disease from those organisms. So in humans, people can eat the muscle tissue once again that's undercooked, or they can get the tachyzoites from animal feces. But this causes fever, joint pain in the primary infection. Immunocompromised people that have immune disorders or on immunosuppressive drugs can get encephalitis and other neurological abnormalities from toxoplasmosis. And once again, in pregnant women that eat meat that is undercooked, has these toxoplasma cysts, they can actually have it cross the placenta and get into the fetus, and it will cause hydrocephaly or water on the brain, if you will, and a chorioretinitis, which actually can cause blindness in the fetuses. So on the upper left is a picture of a hydrocephalic child from toxoplasmosis, and the right is some congenital blindness from toxoplasmosis. Trichinosis. When I was a kid, whenever my mother cooked any sort of pork, whether it was ham or ribs or whatever, she boiled it first and then she cooked it however she was going to cook it. And that was due to this organism predominantly. That was trichinosis. Trichinellospiralis is the primary organism. Trichinella pseudospiralis and Britovi or other subspecies or other species, of the Trichinella organism. This is a worm. It's a nematode parasite. It encysts in the muscles, and the Trichinella spiralis is killed by freezing. 63 hours is what it says in the literature. Also cooking it to 140 degrees. Drying doesn't always kill this organism, so for jerkies and that sort of thing, you need to be careful. And if you're using pork, especially, it's known to be in pork and bear meat predominantly. Trichinella britovi is the one from Europe in European wild boar, and it's very resistant to freezing. So upper left is a picture of the nematode worm. Lower right, these are histopath sections. That's actually the worms inside muscle tissue. So these encyst in muscle tissue, and they can be anywhere in the body. So wild pigs get the parasite from eating infected meat and garbage. In mice, cannibalism. So when we shoot pigs, and if you leave them out there or if you clean them and leave certain parts out there, the other pigs will scarf them right up. So also, I mean, they eat babies and everything else. So also, if they eat feces from other pigs, they've recently eaten infected meat. So when they're eating a carcass, they're going to eat the feces they may have eaten some meat and have the parasite in that. So um, we see about a 3% prevalence rate for trichinosis. So about 3 out of 100 animals will have that. Um, by the way, most of these diseases we're talking about have nearly been eradicated in domestic pigs. So they're raised in confinement in most cases and aren't exposed to these things, whereas on the landscape, they still are exposed. So trichinosis is zoonotic. It causes disease in humans, and it's a pretty interesting progression. So when you eat the meat, your stomach acid digests the muscle tissue. The nematode worm comes out and actually penetrates through your intestinal wall, which causes what's called the enteral phase. You get diarrhea, nausea, vomiting, feel bad. Then it migrates through your tissues and you get hemorrhages, specifically in the nail beds, which is a very characteristic of this disease. Bad conjunctivitis in the eyes, swelling, petechial hemorrhages, headaches. It can infect the heart tissue and the diaphragm as well, which can end up in fatal, human fatalities. It's very rare. Two of the people that historically might have died from cardiac trichinosis are Admiral Byrd and Wolfgang Amadeus Mozart. So I can't prove that, but it's in the literature as a maybe. So the parenteral phase is the chronic phase of trichinosis in humans, and it ends up in weight loss and depression and, interestingly enough, psychological effects, and that's been well documented. So in the upper left, we have the conjunctivitis associated with trichinosis. Upper right, just a big stomach cramping. Lower left, you see little tiny nail bed infections. The little dots are hemorrhages in the nails. And then on the lower right, you have some petechial hemorrhages and edema in the hands. That's another drug pig going back to the woods with the collar on it. We're just going for a walk. You can tell it's drugged because it's not chasing me back to the woods. Enteric diseases. So pigs walk around the woods and eat everything and root up things, and they poop everywhere they go. And when they do that, they shed some bacteria and other organisms, but bacteria into the ground and into the waterways. So there are 4 diseases we see associated with them more commonly than others. So E. coli or Colibacillosis, Salmonellosis, which is Salmonella, Shigellosis, which is Shigella bacteria, and Campylobacterosis, which is a Campylobacter jejuni organism. All of these contaminate water. If you're swimming, you're biking, you get a fancy filter straw from the sporting goods store and you want to try it out and it's got a leak in it. These are all ways that you can catch these bacteria. Improper sanitation when you're butchering your pork. For the people that butcher wild pigs, if you spill any of that fecal matter onto the meat and it's not washed off well, or it gets into the water in the cooler, it can actually infect the meat. If not cooked properly, it can lead to some pretty severe diarrhea and stomach issues. So these things cause bad intestinal cramping, diarrhea, sometimes with blood, fever, dehydration, and actually can even cause toxic shock and death. That's particularly true with E. coli, some of the E. coli's. Pseudorabies. Pseudorabies is an interesting disease. So this is one I kind of made a reference to a little while ago. We'll chat about, but it's a herpes virus. It is contagious to most mammals, and it's, when I went to school, it said most mammals except humans. Well, We've had 2 documented cases of pseudorabies in humans in the past couple of years. One was endophthalmitis in a woman who in China who was carrying pig swill, just cleaning out the slop from the pigs, and got spilled on her, and she ended up going blind. And the second was actually a veterinarian who was necropsying a pig, cut his hand, and he developed a very severe encephalitis. And both of these cases, through genomic testing, they actually diagnosed pseudorabies in these people. And that's a case where we have more sensitive tests that can find diseases where older tests wouldn't. And so we've probably had a few cases around for years and didn't know it till we got some of these newer test methodologies. But in pigs, it causes infertility and abortion, weak litters. In other species, it's called Olszewski's disease or mad itch, and it's transmitted via respiratory secretions and reproductive fluids. So it is a venereal disease of pigs and can be spread through saliva, coughing, potentially at a corn feeder if they're salivating there. So Pseudorabies was eradicated from commercial herds through another test and slaughter program. It is endemic in our wild pig population and a constant threat to getting back into the domestic pigs. So average seroprevalence is 18% in wild pigs. We have been seeing an increase in dogs. Dogs seem to be extremely susceptible to pseudorabies. If the dog is a hog hunting dog and gets cut, gets saliva in its face, gets saliva in a cut, if people are cleaning feral hogs, wild pigs, at their home, and they let the dogs hang around them when they're cleaning those animals, or if they throw pieces to the dogs to eat, the dogs can contract this. It's a very, very bad disease. It's called mad itch because the dogs start itching incessantly and basically rub all their hair and skin off, begin seizuring, and die. Once contracted, it's 100% fatal in dogs. They're usually dead within 7 days of catching the disease. So it's best to keep your dogs away from pigs, especially wild pigs, which 18% of them have this organism. It's just one of our little projects, putting out some telemetry units on pigs in the marsh at the mouth of the Mississippi River. So in the United States, we call these diseases we're about to talk about foreign animal diseases. So since this is the International Wild Pig Conference, we'll call these transboundary diseases. So these are diseases that are not currently found in North America. And it's very important for this group that's watching this presentation. You are the eyes, you are the people on the ground, you are the people who will be the first ones to see these diseases in wild pigs. So please try to pay attention to this. And I have some contact information at the end for people. If you think you see this, call these numbers. You need to call the area veterinarian in charge, the federal veterinarians, or the state veterinarian. Tell them what you saw, tell it where it is, tell them where they are, and we'll talk about that a bit more in a moment. Let's see what we have up first here. This is just what I talked about. Oh, once again, these diseases are very important as far as potential trade embargoes. If we do find these diseases, especially in the domestic pork, many countries will stop buying our pork, and it will lead to literally billions of dollars in lost revenues for our country. Classical swine fever. So this one actually was in North America for a number of years. It's also known as hog cholera, which many of you may have heard of. It was eradicated in the US in 1978 through test and slaughter and a serum administration program. This is a pescivirus. It only affects pigs. It's transmitted via blood, secretions, so oral, nasal, urine, feces, semen, any of the secretions, as well as tissues, meat. It's killed by cooking to 160 degrees Fahrenheit. And these are some of the interesting numbers. It's stable in refrigerated meat for 6 months or frozen for years. So it has acute and chronic forms. Typically it causes lethargy. They're laying around, reddening and hemorrhagic lesions to the skin and large lymph nodes. Cyanosis, so the extremities, ears, the limbs, the tail, the snout turn a bluish color. They get ataxic or wobbly, and a lot of the young pigs especially may die from this disease. So these are some pictures. These are hemorrhages. The spots are actually little hemorrhages into the skin. You see some red and bluish type ears on the pig at the bottom. These are pretty classic signs of classical swine fever. This is the distribution of this disease in the world. This is the current map on the OIE website, which is the World Animal Health Organization. So you can see we don't have any in North America at the time, but you can see we do have some to our south. And if you remember, it's very stable in meat and meat products for months or years. So we do worry with these diseases that people will bring some undercooked or uncooked meat into our country. And if it gets out into a garbage dump or dropped on the side of the road where there are feral hogs, these diseases can be introduced in that manner. So we've got to be very careful about bringing those food products in that contain meat. African swine fever. If you pay attention in the news, this disease has been in the news quite a bit lately. It's on the move. There are more and more countries becoming positive for this virus. It's the only known DNA arbovirus, so it can be spread by bugs, if you will, insects. It's an aspevirus. Only pigs are infected. It's not zoonotic. It doesn't affect people. Transmission is in multiple ways, so it can be direct contact between sick and healthy animals, consumption of infected meat, again, the same mechanism we just talked about with classical swine fever, and this one can be transmitted by an ornithodoros tick, so that's a soft tick. It's a normal virus, or it's part of the normal viruses that are carried by some animals in Africa, notably warthogs, bush pigs, and giant forest hogs. Those are the natural hosts, and it does not cause disease in those animals typically. It also is killed by cooking to 160 degrees Fahrenheit, and uncooked or undercooked meat is infective for 3 to 6 months. So the same rules apply that we just talked about traveling with meat products. The signs of African swine fever, very similar: lethargy, reddening of the skin, cyanosis, turning blue. They get some dermal ulceration and infarcts, which are little blood clots that go to the skin over the joints, enlarged lymph nodes, vomiting, diarrhea, sometimes with blood. So these are symptoms, excuse me, clinical signs They're associated with African swine fever. You can see that they have maybe some little more severe lesions, at least in these cases that we have pictured here on the bottom right, reddened extremities. And these are things for you to look at out in the field. Some of these diseases and others that we're not talking about today, but other diseases that can mimic these cannot be determined or distinguished in the field. So it's important that, you know, a veterinarian comes out there, takes the appropriate samples, gets them through the appropriate laboratory in an appropriate manner, and determines which disease it is, or if it is even a disease of concern. So these are more pictures. This is showing the cyanosis, the bluish tint, some hemorrhaging, and this is a case of the African swine fever. Distribution a little bit different than the classical swine fever. Luckily, we're still represented as a cream-colored country without having this virus found in our country yet. But it's moving around. You can see a lot of the nations on the other side of the world have this disease, and it's spreading pretty rapidly. Foot and mouth disease. So foot and mouth disease is one of the most contagious animal diseases in the world. It's caused by coronavirus. This one's a little different in that it infects all wild and domestic cloven-hooved animals. So a cloven-hooved animal has two toes. So that's pigs and deer and cows and sheep and goats and elk. You can go on down the line. So if they have two toes, this disease will affect them. It is not zoonotic. It does not affect people. Transmission is direct contact with infected animals or surfaces, consumption of untreated meat products, again, and inhalation of the airborne virus. Now, this is a very interesting fact for this disease. The virus can spread 30 kilometers over land and up to 300 kilometers over water just through air movement. So that it can move a long way just simply on air movement. Additionally, although it doesn't cause disease in humans, it can actually get into your respiratory tract if you're around these animals. For that reason, if you go to a country that has, has foot and mouth disease present, you go around the animals, you breathe it in, and then you come back to the United States, you really need to quarantine yourself for at least 48 hours until this virus can work its way out of your system, because you can carry it back into a naive population. So it is, the virus is deactivated by cooking at temperatures 158 degrees Fahrenheit for 30 minutes. This disease actually causes vesicles. It's a vesicular disease, they call it. It causes ulcers and blisters in the mucous membranes of the mouth, the tongue, on the coronary bands. The coronary bands are on the feet, and that's where the hair meets the hoof. That's the area is called the coronary band. And that's why this is called foot and mouth disease. So they get lesions in their feet, their mouth. And this is not to be confused with the human version of hand, foot, and mouth disease. That's not the same thing. So this is what's considered a high morbidity, low mortality disease. It doesn't kill a lot of the animals, but they get very sick. They don't want to walk. They can also get these lesions on their teats, on the udder. So for dairy cattle, they lose production. So the animals, lose weight. They're not walking around. They're not eating. They get very sick from it. But it is a low mortality, high morbidity disease. Historically, foot and mouth disease has not been maintained long-term in wildlife. So if it gets into a deer population, it generally fizzles out. in pigs, if it gets into a population of wild pigs, it may be able to reach enzootic stability in pigs. That would remain to be seen, but it's a disease we do not want, and there once again would be severe trade embargoes with this disease. So the upper left picture here is some ulcers on a tongue. The upper right is an ulcer, a bleeding ulcer on the nose of a pig, right where it meets the hairline. Lower left, you see that's the hooves, and the ergots, dew claws there are sloughing, and they're very inflamed at the junction of the hoof and the hairline. And in the lower right, that's a vesicle that has ruptured. That's actually a separation of the hoof from the underlying tissue there, where there was a vesicle that ruptured. So these are, you may think, you know, some of these are severe, some are pretty subtle, but these are the things that if you're out and about hunting or trapping or shooting pigs and you see these things, that would be something that you'd want to definitely report. So you see the countries in red are the ones that currently have foot and mouth disease or positive for foot and mouth disease. Once again, we don't have it here in North America that we know of and don't want it. So let's try to keep it out. Prevention. So methods to prevent the entry of transboundary diseases. So we want to try to prohibit the importation of meats and other foodstuffs from endemic regions. We want to make sure it's inspected. Any meat that we bring in from anywhere else, we want to make sure it's inspected. We want to prevent immediate contact of immigrants or international tourists with our livestock and with wild pigs. Once again, if you remember the foot and mouth disease, someone can be perfectly healthy, look perfectly healthy, feel healthy, and still be carrying these viruses in their airways. So if you ever travel, they'll ask you if you've been to a farm, if you've been around animals. So that's what that question is about. We need to avoid feeding garbage to pigs, especially if it's uncooked. Most states have regulations to deal with the feeding of garbage. We cook it to keep these diseases in particular at bay. And then we want to maintain constant surveillance. If you don't look, you don't see, as the old adage goes. So we want to make sure that people are constantly looking. We have professionals that do that, and anyone that's out in the field needs to put these little video cues in the back of their mind. And if you see these things, please contact the authorities. Here are some links for you for the federal area veterinarian in charge and the state veterinarians. If you see something that you suspect to be these diseases, these are the people to contact. Quarantine, I have in the bottom. Just on the by chance that you are out in the field and you see some pigs, you come across pigs with sloughing hooves, and you say, "Hey, man, that could be foot and mouth disease. I'm gonna call, you know, our state veterinarian and our area veterinarian in charge." And then you go home to your 4-H pigs, you didn't do good. So if you ever come across some of these diseases you think you may be exposed to, you need to quarantine yourself. And the people you talk to will reinforce that, but you don't want to spread the disease yourself. Safety precautions when handling wild pigs. Wild pigs are aggressive. Most of you have dealt with plenty of them. You know that they're big and strong and fast. They don't have any backup to them. So they should be confined or euthanized prior to handling to avoid physical injury. As far as PPE, that's the little buzzword that's going around now that everybody's familiar with the COVID-19. At a minimum, we want to wear latex or nitrile gloves when we mess with pigs. Protective eyewear, simple set of glasses or face shield, just because some of these diseases can be aerosolized, and that aerosol that gets in your eyes can infect you. Rubber boots that can be disinfected, and there are times when it's wise to even wear coveralls or even Tyvek suits, depending what you're doing and what you're dealing with. But there's no sense bringing these things home on your clothes. We see too many folks that are out in the field and they're covered with blood from head to toe, and we know that X number of these pigs have contagious communicable disease, so we want to try to keep that to a minimum. Meat safety. We get questions all the time. Are wild pigs safe to eat? And the question is, they can be. You need to do a few things to ensure the safety of your family and the people that you're sharing this meat with. But if you handle the meat properly, it can be eaten safely. So you always want to wear rubber gloves and protective eyewear, once again, when you handle raw feral pork. Don't eat, drink, or use tobacco products when handling the raw feral pork. So if I'm drinking a cold drink and I'm cleaning a pig and I raise it to my lips, that blood's going to run down to my mouth. If I get tobacco, I'm going to put it in there. If I smoke a cigarette, it's going to get on my fingers and get to my mouth. We want to keep the blood and the fluids out of your mouth and your eyes. Just plain common sense with any meat. You want to refrigerate the carcass and the meat as soon as possible after harvest, especially in the summertime when it's hot. You want to make sure that when you clean it, you don't contaminate it with a lot of fecal matter and dirt. Clean it as well as you can. These animals typically have a lot of mud in their hair, and so hosing them down first and letting them dry a little bit before you clean them might be in order. Cook the meat to at least 165 degrees Fahrenheit. If you look through the presentation, that's going to be a temperature that's going to kill pretty much everything that we've talked about here. So use your meat thermometer, don't guess, and get it up to at least 165 degrees Fahrenheit. And then wash all of your coolers and utensils with hot soapy water and bleach. Let it dry. If you can, try to have dedicated knives and coolers and whatnot for feral pork so you don't cross-contaminate, but at least disinfect them with hot soapy water and bleach. If you do these things, you can safely consume feral pork. This is my email if anyone has any questions. I'll be glad to answer them. I appreciate the opportunity to speak with you. I hope you're enjoying the 2020 International Wild Pig Conference. Thank you for your attention.